The Nigeria Center for Disease Control says it has confirmed 41 cases of monkeypox and 1 death from the virus as of June 19, 2022. The Director General of the NCDC, Dr. Ifedayo Adetifa, gave an update during the bi-weekly ministerial press briefing in Abuja and adds that the findings have shown that the disease is more common with men aged between 0 to 65 years, including homosexuals. Adetifa assured that the NCDC will continue in its vigilance and therefore encouraged them to step up disease surveillance mechanism to ensure that monkeypox is taken seriously.
Globally, from between the 1st of January to 15th of June this year, there have now been a total of 2,103 laboratory confirmed cases, all reported from 42 countries in 5 WHO regions. For Nigeria, as at the 19th of June, we have had 41 confirmed cases this year and 1 death. So far, we have not seen any evidence of any new or unusual transmission of the virus, nor changes in its clinical manifestation documented here, including the symptoms, the profile of patients, and the virulence when compared to other countries now reporting cases. Unfortunately, just like we've seen for the COVID-19 pandemic, we observe a repeating pattern of the media and public magnifying this disease and pursuing the narrative that to connect the disease to Nigeria, the disease elsewhere to Nigeria at all costs. And as a reason, we have been part of many conversations in the recent weeks on monkeypox, and we are pushing for destigmatization of the disease and indeed renaming to more neutral terms, as we saw was done for SARS-CoV-2. This is why nobody says anything about Wuhan virus, or when we had the second wave, nobody said UK variant, nobody said South Africa variant, nobody calls the Delta variant the Indian variant, and nobody calls the P1 variant the Brazilian variant. Okay, so there is no reason why we should have West African clade, which is almost now synonymous with Nigeria, or Congo Basin clade. Global reports suggest that the disease is being found in people aged 0 to 65 with a median age of 37, and most of them identify as men who have sex with men. Our work continues as we encourage increased state surveillance nationwide and ensure that this focus on monkeypox at this time is used to enable appropriate prioritization of this disease, which has quietly affected people over the past years. Nigeria has been reporting monkeypox every year since 2015, and we should be applauded for the success of surveillance driven by investments by government, by the Ministry of Health, and rather than being stigmatized. The reason why Nigeria is in the news, part of the reasons why we're in the news for monkeypox, is because we have the most data in the sub-region now. And the fact that we have the most data in the sub-region does not mean that we have all of the disease. It just means that we are one of very few countries that have the capability to diagnose and to sequence the monkeypox virus. In fact, next week, in recognition of this expertise and working with the African CDC, we will be hosting fellow African citizens from 22 countries who are coming to learn how to perform monkeypox diagnosis and sequencing. And indeed, we have had to help some neighboring countries to test their samples for suspected cases. So there is obviously an obvious gap in monkeypox diagnostic capacity in the sub-region. So in terms of our response, the NCDC continues to help the country lead the response to monkeypox through the Emergency Operations Center, which was activated on the 25th of May at a level 2 response. We continue to conduct research to properly characterize the animal reservoir, and of course to complete sequencing to understand the full genetic makeup of this virus and to identify any changes, if any, in the nature of the virus from when it first appeared in 2017 to date, to maybe help us understand if there are any changes in this virus that now makes it more efficient at transmission between humans. As I alluded to earlier, while I focused on COVID and monkeypox because of the global situation, this is not to take away from more important endemic problems. We continue to battle Lassa fever. We continue to see the consequences of the COVID pandemic on the disruption it caused to essential health services, especially immunization, continue to show, because we still are seeing measles outbreaks, we are seeing yellow fever outbreaks, and we know that a lot of these are happening because all of the vaccination campaigns and indeed even the routine immunization were significantly disrupted in the past year or more. And what happens is that then you see the consequences further down the line. Last week, we reviewed, in conjunction with people from the Global Task Force for the Control of Cholera, the IFRC, we reviewed Nigeria's National Strategic Plan for Cholera Control. There were many, all of the multi-sectoral meeting involving all of the stakeholders, and this was part of our collaborative efforts to end cholera in Nigeria by keeping it on the public health agenda and in alignment with global cholera control efforts, including the targets of achieving a 90% reduction in cholera deaths by 2030. To conclude, at the risk of sounding like a broken record, let us emphasize again that we must continue to practice good hand hygiene, not just for COVID, but because hand hygiene helps to protect against a range of other disease conditions. We must also practice environmental hygiene. If our environment is clean, there will be no rodents. If we keep out rodents, then we can reduce Lassa fever, we can reduce monkeypox, we can reduce other zoonotic illnesses. And it's important that we also maintain proper respiratory etiquette, especially in high-risk environments and settings, as well as practice other safety precautions for our safety and for those around us.